Hello, my name is Paul Newham and this course is about EMDR, eye movement, desensitization and reprocessing. Now, when EMDR was first developed, it was evolved by clinically trained psychotherapists as a form of psychotherapy specifically to help people overcome PTSD, post-traumatic stress disorder. Then, as time passed and therapists began to collect data and information about how EMDR worked, they realized that this form of psychotherapy was also able to help quite a broad range of people facing other kinds of problems, including depression, anxiety, panic attacks. Now, part of the EMDR therapeutic process conducted by therapists over a series of sessions involves, and involved from the beginning, asking the patient to follow with their eyes the therapist's finger as they moved it from side to side. But as the process of developing EMDR unfolded, therapists began to experiment with other kinds of what is called bilateral stimulation. Bilateral stimulation simply means stimulation that moves from side to side. So following a finger from side to side with your eyes is an example of visual bilateral stimulation. But therapists then began to experiment with making a sound in the patient's right ear, then their left ear, then their right ear, then their left ear. That's an example of auditory bilateral stimulation. Then therapists began to experiment with tactile bilateral sensory stimulation, for example, tapping the patient on the right shoulder, then the left shoulder, the right shoulder, then the left shoulder. Now, this bilateral stimulation, of which the visual form is the most commonly used, was originally strictly and only used by clinically trained therapists as part of quite a sophisticated form of psychotherapy that involves many other processes and techniques beside the bilateral stimulation. However, once EMDR therapy had become well known, many people wanted to try using the bilateral sensory stimulation technique on its own, outside the parameters of psychotherapy, to see if it had other uses besides the relief of symptoms associated with a psychological challenge or condition such as PTSD. And so many of those people began to make videos combining visual bilateral stimulation, consisting of an image that moved across the screen, with auditory bilateral stimulation consisting of a sound that moved from left to right ears as you listened through headphones. And they discovered that watching and listening to these videos helped them reduce stress and relax. And so many of these people began to incorporate these videos into their own personal program of meditation. And so EMDR, that began as part of psychotherapy, began to be used in other contexts. And one of the contexts that it has been used in is mindfulness, because there is a similarity and connection between bilateral stimulation as used in EMDR and mindfulness, because in mindfulness we very often focus our attention on, for example, the breathing in and out, and focusing our attention on the breathing releases us from being so dominated by the intensity of our thoughts and feelings. And so people began to substitute focusing on the breath, which in fact many people find difficult, for focusing attention on the bilateral stimulation of a visual image moving side to side and an auditory sound moving from side to side. And as this began to be more popular, people began to discover that this EMDR, the side-to-side sensory stimulation, was suitable not only for relieving the symptoms of significant psychological problems such as anxiety, depression and PTSD, but it was also very useful for inducing states of calm relaxation, creativity and a sense of inner peace. So in this course, I'm going to take you through the whole journey from the beginning of the discovery of EMDR as a psychotherapeutic method for helping people deal with PTSD, right through to the use of EMDR today as part of a mindfulness approach to meditation and the cultivation of meditational inner peace. Through that journey, I will introduce you to the nature of post-traumatic stress disorder, its origins and its symptoms, as well as its diagnosis. I will teach you how the brain processes memories, particularly traumatic memories, and I will explain how EMDR provides an opportunity to reprocess those memories in a way that relieves the symptoms of PTSD. And I will show you how the EMDR technique has been lifted out of its original psychotherapeutic context to be used as part of a meditational approach to cultivating peace and relaxation. And I will provide you with some videos that you can use that incorporate the EMDR bilateral stimulation for your own meditational practice. Now, I want to point out that the purpose of this course and my intention in offering it is to provide you with some information and techniques that you can incorporate into your own personal program of meditation. It is not intended as a form of therapy to relieve any symptoms of PTSD or any other psychological disorder or challenge. Neither is it teaching you to administer EMDR as a therapist. Now, before we get going on the course, let me just briefly introduce myself. My name is Paul Newham, and I am widely recognised and indeed cited in many textbooks and articles as one of the pioneers of contemporary creative approaches to psychotherapy. And that's because over the past 35 years I have developed a catalogue of techniques that are today used by therapists to help their clients overcome a range of challenges. And I have concentrated for much of my career specifically on developing techniques that help people deal with experiences that are beyond words, that are difficult to describe verbally. And so I have looked at the use of music and movement, drama and other forms of creative expression as a way of bringing out those deep experiences that can trouble us even more if they remain unexpressed. So that's a little bit of information about me and my background. Let us now proceed to explore the phenomena of eye movement, desensitization and reprocessing.